You're live.
Yeah, hi everyone. It's Anita Lambert, your holistic health physio, and Hannah Ross from Vital Physiotherapy and Wellness.
Hi guys.
Whether you're catching us live right now or for the replay, we're really glad you're here. And so today what we're going to be talking about is, can you really prepare your pelvic floor for birth? So we're going to be talking about different topics around, does perineal massage really help prepare your pelvic floor? As well as any kind of specific exercises to prepare you for birth. Plus, we're going to talk about a lot more, and we're going to share some of our favorite resources with you that we share with our clients. So for those who don't know us, both Hannah and I are pelvic health physiotherapists, and we've both worked with hundreds of women during pregnancy to help women prepare their body during pregnancy, but for birth and for an efficient postpartum recovery.
Yeah. So hi, everybody. Again, if you're seeing us live or in the recording, please leave us any questions or concerns that you have. If you know a mom who's expecting or you're expecting, congratulations. Please share this. It's our goal to empower as many women as we can and to provide as much information as we can. And so we get so many questions. And we're just hoping to provide everybody with an opportunity to have a smoother, more educated, more empowered birth experience. So should we jump right in, Anita?
Let's do it.
All right. So thank you, everybody who sent in your questions. If you do still have questions, please post them now, and we will try as hard as we can to answer all of them.
Hi, Sarah. Thanks for joining us. I see Sarah down there. Hi.
Hi, Sarah. Our first question was asked by a lot of women. And I guess it's because we're physiotherapists, so inherently we talk about exercise. But the question is, what kind of exercises can you do to prepare for birth? Anita, you want to take this one?
Yeah, totally. Right, so this is a really great question. And so I just wanted to mention as well, tonight we're going to be focusing on exercise, specifically preparing you for birth. So for labor and birth. So we won't necessarily be talking tonight about general exercise during pregnancy, but specifically for birth. And I also wanted to mention, kind of a specific question we received from Steph, and she asked how to prepare for birth with an existing pelvic organ prolapse. And so I just wanted to let her know, and as well as anyone else watching who is wondering the same question, all the answers we'll be talking about today are appropriate if you have pelvic organ prolapse. And for those who don't know what it is, it's basically in terms of the bladder, uterus, or rectum. Oh, Hannah, you got your pelvis?
Let's bust them out. Yeah. We've been live for about 30 seconds, so pelvises, here they come.
Yeah. So the bladder, uterus, and rectum, which are our pelvic organs, that what can happen is sometimes they begin to lower a bit or press into the vaginal wall, whether from the front, so our bladder, or from the back, our rectum, and start to lower into the vaginal canal. So that's what a pelvic organ prolapse is. And so Steph is wondering what...
And it can be caused by prolonged pushing, which is why it's a concern for women.
Yeah.
Their next pregnancies.
Exactly. Yeah. So if you have one or aware that you have one, definitely keep up with the questions and answers we'll be chatting about, because it'll definitely be relevant to what you're wondering about.
Yeah.
So getting back to specific exercise to prepare for birth.
That was a very prolonged intro, but I appreciate it.
So basically what we want to do is actually release and relax our pelvic floor during labor and birth. So you don't want to be thinking of any tightening, strengthening, the core breath or piston breath you may have recall us talking about last time. Anything that you're drawing up and in, we actually just want to...
Anita, right? No Kegels.
Exactly. Kind of traditional Kegels, or the idea of engaging your breath with your core. You don't actually want to think about that. You want to let everything go. So what we're going to do is review. We talked about this last time, but the breath that both Hannah and I teach for labor and birth is the flower bloom breath. So this idea that helps relax core. So that idea, just to go over, remember our diaphragm that lives under our rib cage, and then our pelvic floor that is at the bottom of our pelvis. The idea when we breathe in, our diaphragm lowers to let air in and our pelvic floor lowers. And as we breathe out to get the air out, our diaphragm lifts and our pelvic floor lifts as well. But for birth, to keep that relaxation going, what you want to do is when you breathe in, you want to actually think of a flower blooming. So a flower blooming out of your vaginal canal, so nice and open. And then as you breathe out, so instead of getting that lift, you actually want to keep thinking of that flower blooming, which actually helps to keep your pelvic floor relaxed. Exactly. And both Hannah and I, we've chatted about this, and a lot of other pelvic physios we've talked to who use this breath. When we're assessing the pelvic floor internally, and we have women do that breath, we actually can feel their pelvic floor relaxing and staying relaxed, which is what you want. So I encourage you trying that breath at home. Again, various labor and birth positions that we'll go over later, but in general during pregnancy. So a really great type of exercise to keep that relaxation or release work going is actually prenatal yoga. There's a lot of amazing poses and stretches and release work.
Not slow yoga though, right? More like a
like a restorative.
Yeah,
kind of that type of great, but that idea of some of those hip opening type poses and you add the flower bloom can be amazing. So one in particular that both Hannah and I teach is malasana, or that idea of that really deep squat or garland pose. And a really great way, if you feel that your ankles or your knees or hips are restricting you getting into that deep squat, even just using a yoga block and actually sitting on the yoga block in that deep squat pose. So if you look that up, we aren't able to show you today, but if you look up that pose, you'll find pictures of it everywhere. And if you're familiar with prenatal yoga or yoga in general, it's often a pose you maybe have already done.
And even if you don't have a yoga block, even if you have a short stool or something, just thinking about knees wider than your hips, and your sits bones sort of spreading as that flower blooms is going to really reinforce that lengthening of those muscles. Right? And
actually, something that I use after birth when I wanted to practice that pose, just in terms of for relaxation, is actually if you have a nursing pillow, it works super well. So you can actually use that to sit on just to help support. So if you have pelvic organ prolapse and you're wondering about that pose, even having something that you're kind of sitting on to feel more supported could actually be really helpful and allow you to still do that posture.
And I like that more than traditionally we would say like the sink squat, like holding onto the sink and then going into a deep squat and holding yourself there. I prefer at this point for my my prenatal clients to be sitting on something so they do feel supported, because then they can get into that real release. And I, it might be a little crass, but I always tell everybody, it's much easier to deliver a baby out of this than it is out of this. So we really want to work on releasing those muscles and not clenching them.
Exactly. Yeah. So if anything you think about with exercise specifically to prepare for birth, it's about releasing, relaxation, opening, hip openers, that type of movement specifically for birth itself. So
allow your body to do what it needs to do.
Exactly. And you may use some of those postures, again, during labor. Your body may want to go into that. And then also using the flower bloom breath during any of those. So if you have any questions about that, make sure you leave them below. Let us know. Say hi. Let us know where you're from. And we do have a question here from Stephanie. Sorry?
She's saying asking how often.
Oh, yes. How often to practice the flower bloom versus the breath where you contract. Honestly, if you're not having any symptoms that's causing you to do the flower bloom breath, generally I'd say like as you get closer in the third trimester, even practicing that breath, for a few minutes each day can be really fantastic. So based on your comfort level, but even just visualizing it and practicing it, the more you can do that, the more easy it will come and the more easy your body and brain will remember during labor and birth. So I'd say generally third trimester.
34 weeks about. We focus on strengthening. Everything else, if everything else is like status quo, we do about week 34, and then from week 34 on, it's all flower blooming all the time.
Yeah. Yeah, exactly. And Steph, we do have your question coming up as well. Steph,
Well, keep them coming.
Yeah, yeah, amazing. So, in terms of another common question that we hear about and that we were asked for tonight is, can perineal massage really help prevent tearing? So, Hannah, I'll have you take that one. Yeah.
So the short answer is we don't know. So there are some studies that say yes. There's some studies that there's, some of the research says that it could actually really reduce perineal trauma, like tearing or the need for episiotomy and that kind of thing. And we're like hoping we hold on to that. But what we really use it for, I think, Stephanie, what we use it for a lot is actually to prepare you and prepare your body for what you're going to do during labor. So we use it if we use perineal massage a couple times a week. We usually, some women like to do it themselves. Most of my ladies have their partners perform it on them. Mm-hmm. And what it is essentially having two fingers hooked inside the vagina and either coming in and out like not in and out, but along from about 3 o'clock to 9 o'clock and back and forth. Yep. This is me with the fingers. Or
going this way.
Or a U shape. And I use it in conjunction with the flower breath because essentially we're trying to help you learn to elongate your muscles, not clench up in response to fear or pain, and get used to experiencing some sensation in the perineum while releasing those muscles. And so I often have clients do it while doing the flower bloom breath and while positively visualizing their labor and their delivery while their partner is performing the perineal massage on them. We're hoping we're going to get prevent the perineal trauma, but really, if you think about it, if something hurts, which perineal massage is not the comfortable thing in the world, it actually feels like pretty uncomfortable. But once you start to do that flower bloom breath, your body really starts to acclimate. Sure. Hi, Kira. Am I pronouncing it properly? You focus on the inhalation. When you're taking a proper breath in, your diaphragm and your pelvic floor work together. And when you inhale, your pelvic floor muscles should release. And so the flower bloom breath is when you visualize a flower blooming. It can bloom also, but it blooms.
Basically.
And Vanna, just outside vagina, and you allow your muscles to remain lengthened while you're exhaling as well. It's really effective in releasing those muscles, and we use it in conjunction with the perineal massage and positive visualization. And it really, if nothing more, although I do believe it has many other positive uses, if nothing more, it gives women a sense of control, that they understand that with the flower bloom breath, when they're experiencing the perineal massage, they can actually relieve their pain. And then that allows their partner to then actually use a little bit more, I don't want to say force, but be a little more
pressure.
Yeah, a little more pressure. And then they can do the flower bloom breath and acclimate to that as well. And all of a sudden you realize, oh my God, I got this,
Yeah. And I think too, a great point that Hannah mentioned is that so often we'll recommend women start to do it around 35 weeks. And so that's also part of the reason why it can be challenging for women to do it themselves. I've had some clients who have, but for any of you who've been pregnant, when you're 35 weeks, sometimes you're not able to reach and apply the pressure.
Or do up your shoes.
So that's also part of the reason why we often recommend that partners do it, but then you can focus on releasing, relaxing, all of that, rather than trying to focus on putting pressure at the same time. So that's also part of it. And really the research that is out there more points towards it being helpful for first-time moms in terms of helping with that perineal trauma. But how Hannah mentioned, and I would totally agree, that a lot of times it just can help the psychological side in terms of just being aware of that area of the body and your pelvic floor and how to release it. So I think there are a lot of benefits.
Right?
Yeah.
If there are devices, like there's the Epino, which both of us have used multiple times. It's almost like a balloon that you insert into your vagina and you pump it up. I think the original idea was to prevent episiotomies. You can pump it up till like the width is actually 10 centimeters, so that you can prepare your body for what 10 centimeters, what a head coming through 10 centimeters would be like. But a lot of women who I don't have partners who work late, or if they're moms without partners, or they have they're just like, we're not doing that. They'll use the Epino, and they can achieve very similar results.
Yeah, exactly. And I think that's the thing too, is that there are different options, because the perineal massage doesn't cost anything, whereas the Epino, there is obviously a fee because you're purchasing a product. But exactly, you're right. Kind of there's differences between the two and how comfortable you feel, as well as the Epino, kind of when it blows up, it's blowing up into a like circle type position. Whereas with the perineal massage, just to kind of go back to that, when you're doing kind of like the horseshoe where you're putting pressure out, scooping down and around, putting pressure out, you want to stay away, if you're picturing a clock, you want to stay away from 12 o'clock going at the top, because that's where your urethra is, and that will be very uncomfortable. And if your partner is doing the massage, you will likely kick them if they end up putting pressure there. So that's the other side of it. The Epino,
you want to stick to the lower part of the clock.
Yeah, when you're doing the actual massage. So there are differences there. But definitely there can be benefits to both physically, but then also how we're talking about the kind of psychological preparation and emotional preparation with it as well. Yeah.
Right.
And there was a question that I wanted to bring up. So from Bree, so in terms of, can a tight pelvic floor prevent a baby from going vertical or head down?
Good one.
Yeah. That's a really, we don't know of any research that's out there right now talking about that. But with that being said, Hannah and I, we've talked about it, and if we've seen women come in who their baby is in the breech presentation, they tend to have a tense pelvic floor, what we call hypertonic pelvic floor. But this is just clinical observation, so this does not mean one equals the other. But it is helpful. We end up focusing on releasing the pelvic floor, balancing the pelvis, creating more space for the baby to make that turn. And oftentimes we see that happening. And the client may be just working with us, but they also may be working with a chiropractor if you're familiar with the Webster technique, and that can help with breech presentation, or working with an acupuncturist as well, which can help. So there can be so many factors involved. So we can't say necessarily one equals the other. But
we do that, reaching out to a pelvic physio. We often have those resources that we can provide to clients as well.
Exactly. Yeah.
So anybody who's joining us now, we want to say hi. Thank you to everybody who has already submitted questions right now during our live broadcast or beforehand. Please continue to submit them. And if you're catching this after the live broadcast, please still send us your questions. We're happy to answer them. And should we move on to our next question, Anita?
Yes.
All right, let's do it.
Good. Yeah.
So one of the questions that I get a lot as well is birth positions. Do you recommend certain to avoid strain, or what are your recommendations in that area, Anita?
Yeah, so definitely for the actual kind of labor part, upright positions have been shown to be helpful, using gravity to your advantage, squatting, walking, using the birth ball.
I always show those videos of women who are dancing during pregnancy. That's my dancing.
I know.
So that's embarrassing, but I won't dance on.
No, but again, it's fantastic, right? It's anything to open up.
And anatomically correct, yeah.
Yeah, opening up the pelvis, opening up the hips, that kind of idea is quite helpful. For the actual birth part, what can be helpful? So traditionally, it's generally women are on their back or kind of in a semi-recline, so you're kind of on your back, but you're a little bit upright. And so what happens in that position is, I'll bring out the pelvis again, is in that position, so your sacrum, which is right here in terms of that triangle bone.
Do you want me to, I'll Vanna it.
Yeah.
There we go. I'll be Vanna right.
Yeah, and the tailbone, when you're lying down or you're in that position, those particular parts are actually kind of, we call it like glued to the table. Like they don't really have space to move.
Which they do. They have like about 4 degrees of movement, but that's really important during
as the baby descends. Yeah, and as the baby starts to descend and coming closer to crowning. So that idea that we want having positions that your hips and your sacrum and tailbone are free to move can actually be really helpful. So positions like hands and knees, if it's available to you. And depending, there is a lot of them, maybe you may be watching and think, well, if I have an epidural, like they're not going to let me to go on hands and knees, or squatting, they won't let me go squatting. A position that can work really well is actually a gravity neutral position, which is side lying. And so with side lying, you would have either your partner or your nurse or a midwife or someone would be holding your top leg for you.
And if you're lying on your back, you'd actually have to have 2 people holding your legs. So lying on your side is half the work.
Is less. Yeah. And so that idea, if you're in side lying, that idea that your sacrum and tailbone still they're available in terms of movement, and you're technically still supported by whatever surface. So if you're in the hospital and you have an epidural, you're still supported by the bed and someone holding your upper leg. So it should often still be an option, depending how things are going. But sideline can often be an option, whether a medicated or unmedicated birth, and then it just allows more movement. And that's actually something more the research has kind of looked into, is that idea of the sideline position can help keep a higher percentage of an intact perineum versus some of the other positions.
And I think that's really what most women are worried about, right? And so a lot of this is, how do we get the baby out as safely as possible while keeping the mom as safe as possible?
Yes, exactly. So sideline can be a really great option. And I tell women, go over this with your partner. And so Hannah and I, in our physiotherapy sessions, we go over this with the clients so they know what it looks like, and how that feels in terms of with someone holding their top leg. And then have the client discuss it with their care provider. So whether you're with a doctor or midwife, talk to them, have you had other patients deliver in sideline? Is that okay? Are you open to that type of idea? And then for birth, again, reminding whoever is actually at your birth that that's a position you would like to be able to try.
Right. This is when having a doula comes in really handy as well, because it's somebody who's there advocating for you the whole time.
Exactly. And so squatting position can be fantastic during labor and can be fantastic during the actual birth. And technically our pelvis is quite open when we're in that deep squat. The other side to it is our perineum, that kind of the research that is out there shows that there could be more compromise of the perineum in the deep squat, just because there's so much pressure on that area.
It's like almost like overstretched.
Yeah. But that being said, it definitely can be an option. And a birth that I and she had the squat bar, but the nurse was supporting the perineum. So that's kind of the side
providing upward pressure.
Yeah. So checking. So kind of the perineum is that area between vaginal opening and the rectal opening, is having that supported. So again, talking to your care provider about that if you're looking to squat for birth, if asking about having your perineum supported. So different options that are definitely there versus the traditional option. And
let's say you just, you know, you had a beautiful plan and now you're on your back with an epidural. There's still you can still optimize that position by even rolling up some towels. I usually have my clients bring two hand towels with them, and they roll them up and they place them on either side of the sacrum. So they would put a rolled towel, like a little tube over here and a little tube over here. And when you're on your back, it just provides you with a little bit of lift so that your sacrum has a little bit of mobility. I still prefer side lying. I still prefer 4-point kneeling. But whatever, you know, we can optimize any position and really make it work for you.
And another thing I wanted to bring up just about labor positions. So if you do have an epidural and you're not able to be out of bed, you're in the hospital bed, something that's been talked about more lately is actually using a peanut ball. And so if you picture an exercise ball or a birth ball, it looks similar, but it's shaped like a peanut. So it's got kind of two round parts on either end. And many hospitals are starting to implement this. Depending where you're watching us, every hospital is a little bit different, but I know here where we are, the hospital actually here in Peterborough, I'm so excited that now every room has a peanut ball, which is fantastic.
A wonderful lady, Sarah Mickler, she owns a clinic in Toronto. She donated to all the hospitals there. Thanks, Sarah.
Yeah. And so just again, that can be something, and there's limited research out right now, but what it's saying is that there could be help in terms of using the peanut ball in terms of comfort, because it helps to keep your pelvis open. So even if you were to look online and look up peanut ball for labor, you'll see a lot of different pictures.
Let's add that to our resources, Anita.
Yes, that you can use for birth. So it can help just keep the pelvis open, could potentially help shorten different parts of labor. So definitely something to, again, ask about at your care provider, as well as where you're giving birth. If you're giving birth at a hospital, check to see if they do actually have them, or if you're having a doula, they may actually have it as well.
Go doulas. All right.
Yeah. Fantastic. So let's see, in terms of our next question. So in terms of Hannah, so a lot of women ask, how do I use my core to push during birth? So this kind of goes a little bit back when we talked about relaxing your pelvic floor, but we'll go into a little bit more detail and kind of how to push or not to push.
And so let's just revisit again what your core is, because again, there's so much misinformation about it. When Anita and I are talking about your core, we are talking about your inner four core muscles. So your breathing diaphragm, your pelvic floor, which we just talked about when we were talking about the flower breath, your inner abdominals, and your inner back muscles. And we essentially do exactly what we just finished saying, but we use our core by lengthening it, by allowing that, you know, that release that the diaphragm causes with the pelvic floor on the inhale and the flower bloom breath. And we actually, closer to delivery, I have my clients perform it more and more, and along with the visualization of your, you know, positive, easy, whatever positive words you want to use with our labor and delivery. And we use that though for the pushing stage as well. But when we're talking about our core, we actually want to use it. We want to use the cues that our core is giving us to tell us when to push. And this is something that's really important when it comes to preventing perineal trauma or any issues surrounding that, and protecting yourself. Pretend I didn't say the word trauma, because I don't want to say that word. But essentially, when you get to the hospital, they keep checking you. Or if you're birthing at home, your midwives will keep checking you, and everybody's going to keep telling you how many centimeters dilated or how many, how far along you are. Doesn't matter who your birth provider is, midwives, OBs, GP, doesn't matter where you actually deliver. They're going to keep using that as an indication of how ready you are to deliver. but your body has its own indicator, and that's the ejection reflex. So when comes time to push, your body tells you it's time to push because you feel the need to push. So when you've listened to your body and you push when your body is ready, and not necessarily when someone says to you, okay, well, you're 10 centimeters now. Do you want to try to push now? That's actually using your core, because your body is ready and available, and then you can start to do your flower bloom breath and lengthen those muscles and allow your beautiful baby to come into the world. Very often women will get to 10 centimeters and their body actually just takes a break. They go into sort of a rest mode. And so if we use the 10 centimeters dilated as an indicator when your body is ready versus when you feel the need to push, often women will start to push before their body is actually ready. So we really encourage, even if you have an epidural, I really encourage my clients to ask for that to be reduced or stop topping up, so that you start to feel, you don't want to feel pain per se, but you do want to have sensation. So you feel when your body's you're going to know that you have to push. And then you can start to do your flower bloom breath. And we know, I think our studies are we can almost doing this alone can reduce pushing time by about 50%. Because
that idea of laboring down. So a lot of times, and even actually I've learned that the hospital here actually does that now too, that kind of generally if a woman gets to 10 centimeters and does not feel the urge to push, they encourage them to wait at least an hour. And that's going towards the new research. So that idea that exactly our body is brilliantly made. And so this idea that the uterus kind of takes a bit of a break, it's still in terms of doing its thing, in terms of helping the baby move down. But your body may take a bit of a break and you may not feel the urge to actually push. So going with that urge, but again, how Hannah talked about with an epidural, that definitely is something to talk about with your care provider, but also talk about whoever's at your birth, because that may be different, right? Especially if you're in a hospital environment. Oftentimes a nurse will be with you through most of it. So talking to them about it, and that idea of, topping up or not topping up your epidural, but seeing if you're able to go or at least labor down for that amount of time, because even if you're, depending on how much the epidural has set in, you may not have any of that feeling. So at least giving your body that time
to get some back,
to move the baby down, can be really helpful. And so, because that idea, the kind of purple pushing or the Valsalva pushing,
that somebody said to you, take a deep breath, hold it, and now push and count to 10.
And push.
And that goes back to our question also about pelvic organ prolapse, right?
So that idea of, yes, when you do that, you take a deep breath in, how we talked about your diaphragm lowers, your pelvic floor lowers, so it's lengthening, right? And then you do that hold and you add more pressure. Yes, the diaphragm's pushing down. Yes, that kind of pressure is pushing on the baby, but it's also pushing potentially on your pelvic organs as well, and adding extra stress that may not necessarily need to be there. And so that idea of using the breath, and when you're going with the urge to push, every woman will be different. Some women, and if you're watching this and you've given birth, maybe you grunted during the pushing phase. Maybe you were making, all different sounds, and being encouraged to kind of keep your mouth relaxed, keep things open, because that can help below in terms of keeping things open for birth. So that idea of not feeling like you have to hold your breath, but letting some of the air out can just allow your body to not put as much pressure downwards, which potentially can help. And I want to, in terms of, say hi to Suzanne. So she said she met with her midwife who just told her about the peanut ball, which is fantastic. So depending what kind of birth you're planning, that could definitely be a fantastic option.
And I think the point is there are options, right? There are so many options. There's no one size fits all.
Yes, that's really something, Hannah and I talk about a lot and talk about with our clients, and we want to empower you as well, is that going into a birth, you may have preferences of what you picture your birth to, how it to go. And what can often make the difference of a positive experience versus not is being educated on what can happen and that you can be an active participant in your birth. And we'll talk a bit more a little bit later, but having a doula can also help that as well, help to advocate for you. But that's the biggest part. So some women go in feeling like, you know, I've been told not to plan, not to have preferences, just to go in. And I think there's
I love the flexibility, but it has to be you have to make educated decisions. And so don't educate yourself to scare yourself. But we're going to give you some resources that we love. You know, information is power. And then you can go in and say, okay, this is going on, so I'm going to choose this option. And you can be more educated about your selection.
Yeah, and I think that's the biggest
part. It's my 3-year-old, so.
Hi, Isaac. Going into birth educated and having whatever preferences, but the education is the key part. So then when twists and turns, if they happen during labor, during birth, you, and if you have a partner with you, can kind of work through that and ask questions. I remember the birth I mentioned before of a client she gave birth in squat. But I remember throughout her birth, different things came up, and she would turn to me, and I was her physio doula, and she would say, well, what would you do? And that as a doula is not our job to tell them what to do, but to help them work through it. So I would say, you know, ask your care provider. Like the OB was there. I was like, ask the OB, you know, what are the pros and cons if you were to do this, if you weren't to do this. And so that's really the idea of all this education. We had talked about it, so she knew, but she almost needed that extra reminder of like, hey, you know, I can ask about this.
Absolutely. Just providing that support to the mom so that they know they get to make the decision. It's their birth.
Yeah, exactly. And I want to say hi to Marlene. She's here from Collingwood. Hi,
Marlene.
She's an acupuncturist, a birth doula, a mother of 1 and a 3-month-old, and she says awesome info. Thank you both. Thank you, Marlene, for joining us. I think the biggest thing to take away tonight is there's a lot of education that you can take into your birth with you. And when we talk to mothers after their birth, I think the biggest thing is that going into it, they feel prepared, but also making those decisions during labor and birth creates more of a positive experience.
Totally. And we want to share some of the resources with you. One of them that we really talked about was spinning babies. Do you want to talk about that a little bit?
Yeah.
She's 3 months pregnant. Sorry, not 3 months.
Oh,
3 months pregnant.
Yes, 3 months pregnant. Congratulations, Marlene. So in terms, so spinning babies is a fantastic resource I love to recommend to clients. And we'll post it below. So it's spinningbabies.com, and it's a resource that was started by Gail Tully, and she's a midwife in the US. And they're fantastic. There are online classes you can take as expecting mom or as expecting parents, and different ways we've talked about kind of balancing the pelvis or creating space, creating kind of support or balance in the pelvis, basically. And as well, if you have a breech baby, she has great techniques that you can, again, use at home to help with turning the baby as well. So I really encourage you. Plus, if you are in labor, I
used this for my 3rd pregnancy. Breech and
Exactly. And it's amazing. The way she's created the website is fantastic, because literally if you were in labor, you could go to the website and click on I'm in labor, and you'll get tips right away of things you can try if your labor is stalling or if your baby is posterior, anything like that. She's got tips you can try kind of in the moment. So
we need tangible, useful information.
Exactly.
Which brings us into our next one. That's Kim Vopni's book, Prepare to Push. And I love this book because it's also super simple, really very easy to understand. It's very much like what we chatted about, how to, use your anatomy and use your physiology and use some basic tools. And it's like a weekend read. And so it's not like a huge monstrosity of a book. So I always recommend my clients read that.
Mm-hmm, exactly. And exactly. There's the online workshops, there's the in-person workshops. So even Hannah, at your clinic, right? You're starting to do the Prepare to Push workshops.
Yep. We're hosting one next weekend. Yeah. Sorry, next week, Wednesday. Yeah.
Fantastic. Another resource that I wanted to mention, and we've talked a little bit about it, is actually the benefits of having a doula. And so if you caught,
a workshop on that as well on this Wednesday.
Yes, exactly. And I did a Facebook Live recently with a local doula here, and we went through all the common questions that we often receive about doulas. So we'll post that below in case you missed it, and it answers all the questions you could think of the benefits of having a doula, because research does show that there are benefits of having continuous labor support, which is basically having a doula. So it can really help with a positive birth experience and decrease the likelihood of different things throughout birth. So the rate of cesarean birth or interventions or medication if you're looking to not have a medicated birth. So I encourage you to check that out and check out doulas in your community.
Yeah. And the last one that I wanted to mention, there he is. Okay, come over here. This is my son, and he's here to tell us about our last.
So in the toilet, there was something.
Okay, I love you. Hi, everybody. Our last. These are my children. Our last resource is The Birth Partner, which is an amazing book. Both Anita and I read it for. Yeah, go with your sisters, and they're gonna help you. That's crazy, guys. It's okay. You can go give him some milky, okay? I'll be up in a second. I love you guys. In a minute, okay? I love you.
I love this. It's live, and this is what it's like being a mom, right?
My husband's out of town, so I put my kids into bed before we started, and here they are. So The Birth Partner is an awesome book by Penny Simkin. Both Anita and I read it. It was one of the resources that when we took our doula training, our physio doula training. And in fact, it was the book that when I had my first baby, who was just in here taking my son's temperature, when I was pregnant with her, the doula that I did all of my prenatal education with, and the doula that she's like, I love her, she gave me The Birth Partner to read as well. So I read it both to become a labor and delivery educator and doula, and also as a pregnant woman myself. And it is a hefty book. There's a lot of detail in there, but it's so informative and useful.
Yeah, no, I totally agree. No, that's fantastic. So we'll definitely post those resources below afterwards so that you can check those out yourself. Yeah. So in terms of, Hannah, anyone who's joining us for this Facebook Live for the first time, how can they find you? How can they contact you?
Yeah, you can find me at vitalphysiotherapy.com. Or you can find us on Facebook at we are Vital Physiotherapy, or Instagram we are Hi Laura. Hi. Laura's not my Instagram. And we are Vital Physiotherapy and Wellness, and we're located in Toronto and St. Clair West area. And Anita, what about you? How can they find you if they have questions?
Yep. So I'm the owner of Holistic Health Physiotherapy here in Peterborough, Canada. And you can find me at holistichealthphysio.com. You can also find me on Facebook or Instagram at Holistic Health Physio, or on Twitter at holistic_physio.
Love it. And so we are doing this, every 2 weeks. And our next Facebook Live will be during World Continence Week, and we will be talking about bladder leakage and incontinence. And if you guys have any questions or any concerns, or you think it's not a big deal because you just leak only when you're coughing or sneezing or laughing on a really full bladder and it's not a big deal, let's talk about it, because we have a lot to say, as we do on every topic. So tune in to Facebook Live.
Yeah, definitely. And in terms of, so if you found tonight's chat helpful in terms of preparing for birth, you can also check out, I've created a free resource with kind of my top 7 tips about how to prepare for a positive and fear-free birth. So I'll make sure to post that below. So feel free to check that out for more resources and more tips. And then Hannah also has a wonderful workshop coming up.
Yeah, on Wednesday, we have a Birthing from Within workshop along with the West and naturopathic doulas at my clinic. It's a free workshop. It's going to be amazing information. And again, we're just hoping to empower women and ensure that you can optimize your birth and answer any and all questions that you have. If you have any questions about that, we're going to post the information as well below.
Awesome. And hi, Lauren. Oh, we're excited. So yeah, definitely we're looking forward to having you join us at our next Facebook Live. Yeah. So definitely check out, so both our Facebook pages to know, because each week may be different in terms of which page we'll be live on. So make sure you check both out, like both our pages, and then you won't miss it. Okay. So excited. So we're so glad all of you came. If you watching the replay and you have comments or any questions that we didn't cover, please post below. Hannah and I will make sure that we answer them and get back to you. So thanks for joining us, and we're excited to see you on our next Facebook Live.
Looking forward, guys. Have a good night.